Hi everyone. So I wanted to pop on here and just demonstrate what's called straw phonation. I've discussed this a lot in my other videos, and I've discussed this on my Instagram account and blog posts, but I just wanted to give you all just a demonstration of what that actually looks like and things to be watching for when you're doing it incorrectly versus when you're actually doing it correctly. So I'm going to start with my straw here. You can use a straw of any diameter. I would recommend a normal diameter straw to start with, because the smaller diameter that you're going to get, it creates more back pressure, but it could be more difficult to start with at first. So I would start with just a normal diameter straw. You're going to put the straw in between your lips, and you're going to make that buzzy hum sound that we've been talking about. So again, the hum sound is to get a lot of buzz forward. That's what you're going to try to do with the straw in your mouth. So I feel a lot of buzz here. It almost sounds like a kazoo sound. Feels really, really easy in here, which is key. Again, I feel a lot of forward feedback, a lot of forward sensation there when I do that. I can do, so I want to be doing this at my normal pitch, normal loudness. I'm not trying to be high in pitch. I'm not dropping down at all. It's my normal pitch, but also my normal loudness. I'm not trying to be super loud by any means. One strategy I love is putting the straw in a little bit of water and trying it that way. So you're going to try the same thing you just did, just in a little bit of water. You can see that it makes bubbles, and you want those bubbles to stay really, really consistent when you're doing it. Again, you should feel like consistent forward focus, consistent bubbles. It should feel easy. If I'm pushing at all, it'll be really hard to start it, or it'll be kind of choppy. So you want to make sure that you release your throat muscles, relax in here, and really forward focus on that forward buzz that you're going to feel when the straw is in your mouth. If it's easier, you can go from out of the water to in. Right? I'm not changing anything when I'm putting it into the water. It just changes what I feel a little bit. It almost takes more pressure off of my vocal folds, but you will hear the bubbles when you put it in the water. That's the main difference. You always want to be doing this with sound. If you're doing this and just blowing bubbles, it's not going to do anything for you. You always need to have that combination with the sound. What this does is it creates a really optimal, efficient voice pattern for you to be speaking in or just making sound in. When you put the straw in your mouth, you're actually elongating the vocal tract. This is serving as basically an extension of your vocal tract. The sound is also moving through a very narrow tube, which changes the pressure dynamics in a very efficient way. So it requires less subglottal pressure, less push in order to start the vocal folds to vibrate, which is what makes our sound. But it also requires less effort, less squeeze of your vocal folds, and it unpresses the vocal folds if you're starting to squeeze or push them at all to make voice. Some people describe this as almost like a massage for their vocal folds. It can feel really, really good once you feel what it feels like to actually release some of that pressure and get resonance without any sort of push or effort in your throat. So again, you can do it outside of the water, on a hum, inside. Start off with this diameter. When it feels really good, you can go down to a smaller, almost stirrer straw. And you'll notice that might be a little bit harder at first to coordinate, but it actually will take away even more pressure than something like this. But again, start with this until you get really comfortable. If you're having difficulty, you might be holding your breath. So if I'm holding my breath and trying to do this, nothing's going to come out. It's going to feel really effortful. Same thing with if I'm trying to strain to reach a high pitch. That feels really difficult. So I want to stay at an easy, normal pitch, get that consistent breath flow, and make sure I'm scanning to make sure I'm not holding breath at any point. I'm not holding my breath in my throat. I'm not holding my breath in my abdomen, right? All of that is released, so I'm able to get that consistent airflow to make the bubbles or to just make the sound come very smoothly through the straw without any effort on my part. You can use this as a vocal reset technique. So if you're speaking a lot throughout the day, use this in between patients, in between clients, in between classes you're teaching. Even 30 seconds can time really reset your voice and just bring it back here, take away some of that squeeze that you might be feeling. I use it also as a vocal warm-up technique. So I'll just do a little bit of straw phonation in the beginning of my day, but also before I have any longer phone calls, any virtual calls, and I will do it in between my patients or in between meetings because it does constantly just give you that reset, placing your voice in the most optimal configuration, placing it in the optimal placement that you want it to be, forward and here, not down here. Again, we can use this as a reset technique, but also as a facilitative technique to teach you how to start speaking in the same way, right? You might notice that when you speak afterwards, your voice might be a little bit more released or a little bit less strained. And we want to notice that and see if we can keep that a little bit when we're talking. So if you do this and your voice is more released or more forward or just feels freer or lighter, see if you can notice what that feels like, how that feels different from your typical maybe speaking voice, and see if you can just keep that for a little bit longer of a duration, trying to perpetuate that way of speaking where you're actually speaking in a very optimal coordination pattern as well, versus what you might be doing normally, sinking down in your throat, feeling roughness, feeling effort, vocal strain, all of that. So this is a great technique for resetting, for warming up your voice, but also for teaching you where your voice should optimally be coming from and how it should really feel when you have that really, really great, easy, optimal voice functioning pattern. If you have any questions while you're trying this, please reach out to me. These are designed to be done with a speech language pathologist, so please work with a speech language pathologist who is specialized in voice. I offer free consults for individuals who are interested in those kinds of services. So please email me. We would do the free consult just virtually. So you can email me at info@speakingboldly.com. So SPEAKINGBOLDLY.com. info@speakingboldly.com. Email me, let's set up a free consult, discuss your needs. Maybe you're feeling some hoarseness, you don't know if it's normal or not. Hint, any sort of hoarseness, any sort of voice difficulties are not normal. But we can talk about your vocal demands, your voice symptoms, how you're having to use your voice, what difficulties you're having, maybe with a mask now, maybe projecting now, maybe speaking virtually, speaking more. We can talk about all that, kind of design what your optimal management plan might be, if any, and go from there. You might also want to check out my blog, so speakingboldly.com/blog-1. There are a lot of helpful resources there. And obviously you found my YouTube channel, so check out the other videos. I have lip trills on there, some techniques for speaking with a mask, and I'll be continually adding more and more. So please check out the rest of the videos, subscribe if you're interested in getting the latest content, and I will see you soon.